I want to concentrate on health right now. A lot of us Americans and people across the world have been stuck inside for this entire lockdown for this last year. And we have actually been affected indirectly, even if you have not been directly dealing with COVID. Though there are many statistics to talk about how the people who are directly affected then also affect, about nine other people indirectly with, stress, just general problems with if they're dealing with the health services centers and etc. So the health of millions of Americans may have been affected by weight gain and lack of exercise during this pandemic. When avoiding direct dangers of the COVID-19 infection, emerging evidence collected by obesity researchers. So remember, obesity isn't always the best factor in understanding what is good and bad about health, but obesity oftentimes is a good scale of people who are going to be uh, have problematic chronic health problems like heart disease, stroke, diabetes, and certain types of cancer. So when we talk about it, there's an overwhelming stress of living in a pandemic time that is really impacting patients in medical health significantly. One of the doctors here was talking about how normal patients are like having about weight gain of 10 to 30 pounds, including about basically 1.5 pounds per month. So for over 12 months, that really adds up. Um, and it's about lifestyle where we have less exercise. We have some of our diets are not improving. Some of us are trying our best, but there's a bit of a hard culture when you're constantly cooking in your own house, and you often then are then getting takeout maybe, and just the general stress of all of this. So I just want to focus on all of this happening, and it's something that we just need to keep focusing and understanding that this is happening to us right now, and that it is a live acting stress. So we need to empower ourselves and try to exercise, try to get some yoga in, try to do the stretches. um you're just gonna have to do it because your lifestyle is going to has changed and is going to change, especially with COVID-19 in its certain situations. And I'm going to tell you that it's not going to affect everybody. It's probably going to only affect 60%, 50% of Americans. There's some people who have had better habits because of this. But I just want to state, please concentrate on yourselves and please try to find a way to take care of yourselves during this pandemic and the end of this pandemic. I don't want you to go out there unless you are inoculated, get the vaccine, and are doing well. And I want everybody to make sure that they realize that there's just risks and that they're going to have to adjust themselves for a little bit.
Yeah, I definitely agree. I heard of a study that they said that people's bone densities are changing because of the fact that they're not exercising and they're indoors, and a lot of things have been affected because of COVID. I read about something like that a while ago, when it all started, that they said, be prepared because you're going to be on lockdown. You're not going to be able to walk as much and do a lot of the different things that you used to do. So yeah, that's crazy, man. That's crazy.
There's
Um,
like a lot of studies about sedentary lifestyles, that your job and everything like that, that if you're mostly sitting down, truck drivers, people who work in the office spend all that time on sitting in an office chair, that they do end up having more physical problems. So you got to think that this is only going to contribute for a lot of people staying at home, relying more on comfort food, especially for their mental health, and putting all those things, maybe at one time saying, oh, yeah, I've got to watch my weight. I got to make sure I'm ready for the summer and all that other stuff. But then when the pandemic hits, like, well, I'm going to be inside all summer. So who cares? This makes me feel great. People started drinking more, they started eating more, they started eating junk food more, and I think that now a lot of that stuff is coming to the surface for a lot of people as they're starting to reopen a lot of things and having to go back to work and
mhm.
dealing with a lot of pain and discomfort that they might not have had before. And it's something that, for I know like if you survived this pandemic, don't beat yourself up about a lot of stuff. If you survived, I think that's 100%. That's great. Now you have to really look at yourself and taking care of yourself. But at the same time, there were people that thrived and there were people that didn't. But if you survived and you saw the end of it, of which we are coming towards the end, thankfully, we're starting to see some kind of light at the end of the tunnel. Give yourself enough credit, at least for that you survived it. But yeah, you have to look at what has come out of it and what you might need to do going forward. But I think that that's a big, huge step that a lot of people did survive. Though there was a lot of people that we've lost, unfortunately, this last year and this year. We've lost a lot of people, and it's hit people emotionally in different ways. And being at home and having to be in a space and just thinking about the spaces at home. We've been so focused on this open concept living for so long. And now you've had your whole family shoved into a house with this open concept where there are no rooms almost for you to have a sanctuary space.
Yep.
There was a lot of people that had to come to terms with that too, so you don't have a workout room. People bought a lot of workout equipment, but you don't have a workout room. There's no space for you to try to exercise. You have a small apartment, or you don't have the house that now that it's filled with all the kids and your partner and everything else, you don't have the time or the mental capacity to do the workout that you had planned to do, or to do whatever other kind of regimen that you had planned. Don't beat yourself up about it, but look at it from what it is now. You survived, you moved through it. Now get yourself back to center and seeing about getting yourself into a healthier space.
Yeah. Depression and binge eating, right? And people playing video games and doing things to pass the time don't allow them to actually exercise. I mean, they could, but a lot of people choose not to because, I need to entertain myself. I'm bored. I'm this, I'm that. And, exercise is work, right? Nobody really wants to exercise. They do it for reasons of health and stuff. Some people enjoy it, but most people don't. But now you're kind of required to, right? It sucks, man, but it's a necessity, and you're 100% right, Anthony. People need to get all that stuff situated. They need to exercise. At least go for a walk in the park or something. Yeah.
And it allows us to recenter ourselves into thinking about, because the pandemic itself gives us the space to think about, what do we really need to do to center ourselves? And like, exercise is actually a big part of it. I find that, as on tilt as I am on a lot of occasions, me doing my exercises in the morning while I've been out of work has been one of the crucial parts of keeping myself together, keeping my weight under control in some ways, because even though I eat pretty well, I don't, if I'm at home, I'm going to be cooking all the time. And your process of eating is different. So it's like, it's just understanding yourself differently. And I think that's one of the things that people are going to have to process now, when after this is going to be like, oh, what do I have to do to take care of myself? And I just want to make sure people start to think about that. What do I need to do now to be a different, not even different, but be a better person?
Definitely.